2:39, so I think that is probably about time where we can get started. Hi everyone, welcome to Zoning and Housing Day run by Next Gen Voices, which is Newton North Civic Engagement Club. We are also we also would like to extend our welcome to our fellow classmates and faculty from Newton South High School. So we're very excited that this is going to be an all Newton High School event. So before we begin, we'd like to thank our advisors and sponsors at the Center for Civic Engagement, who have been instrumental in putting this event together. So I will pass this off to Claudia and Terry for a few words before we begin.
You're muted, Claudia.
All right, here we go. Hi, my name is Claudia Wu. I'm one of the co-directors of the Center for Civic Engagement and Service here at Newton North. And just a few words about the center. Our mission is to provide an opportunity for every student to participate in civic life and community action. We're nonpartisan, we're pluralistic, and we really are student-driven. And this project really came out of a lot of students who were concerned about or were interested in the housing discussions around the city and elsewhere, and wanted to bring more information to their student and faculty community. So that's really how this project developed. I also wanted to say that we wanted to highlight that this program is part of the Dan Fahey Speaker Series at the center. Dan Fahey was a longtime resident of the city of Newton, very involved in civic life. And this speaker series is in memory of him and all the things that he felt, the dialogues that were important to him. So I'll hand it over to Terry.
So hi, I'm Terry Yaffe. I'm the the other co-director of the Center for Civic Engagement and Service. We hope that after you've seen this event, that you'll think about the role you can play in shaping the future of your community. And know that your voices, no matter how young, how old, how quiet, how loud, are very important. It's our pleasure to sponsor this program and to work closely with our students on this. We thank our moderator, Mr. Gessold, and congratulate our students, Coral Lynn, Olivia Posen, and Audrey Posen, for the excellent work and their commitment to bring this information to their community. Audrey, by the way, created this beautiful poster in the background, so woohoo, Audrey. And I'm going to hand it off to Olivia.
All right, so hello everyone, my name is Olivia Posen. I'm a junior and officer of Next Gen Voices. And this block, we are going to be focusing on housing in conjunction with economics, sociology, and public health. And so joining me today as a co-moderator is an NNHS faculty member and history and economics teacher, Mr. Gessold. I'm also excited to be introducing our three incredible panelists here today. So first, we have Allison Bovell-Amon, who serves as the Director of Policy Strategy for Children's Health Watch at Boston Medical Center. In this role, Allison leads the federal policy work of Children's Health Watch to address social risk factors among patients and families locally and nationally, and to promote laws, policies, and relationships that improve child and family health. Ms. Bovell-Amon also works on multiple projects addressing housing instability and homelessness among patients and families at Boston Medical Center. She is a Master of Divinity from Boston University School of Theology. Next, we are joined by Albert Simmons, who graduated from Newton North in 2007 and went on to graduate from Suffolk University with a Bachelor of Science in Political Science. Albert worked as a paralegal for an immigration firm and then became the paralegal for the Leased Housing Division of the Boston Housing Authority in 2016, which provides 14,979 rental assistance vouchers to people and families around Massachusetts. Albert currently resides in Norton, Massachusetts with his wife and young son. And last but not least, we are proud to welcome Elizabeth Heyer. Ms. Heyer has more than 35 years of professional experience in affordable housing development, planning, policy, and advocacy in both the nonprofit and public sectors. She is the Chief of Real Estate and Innovation of Two Life Communities, an organization that builds affordable housing for seniors. Ms. Heyer has a master's degree in urban planning from MIT and lives in Newton. Her two children graduated from Newton North in 2018, and she serves currently as the chair of Newton Housing Partnership, which advises the mayor and city council on affordable housing policy and advocates for expanded affordable housing options in the city. Sorry, that was a lot of words, but now I will hand it over to Mr. Gessold to get our panelists started, our very awesome, impressive panelists.
Thank you, Olivia. I know that each one of our panelists has prepared some thoughts drawn upon their life experience and their professional experience to share with you. So we're going to give each panelist an opportunity to share their thoughts with you. And once we've gone through all three, then we'll turn to the question that you
Sorry.
provided us and the questions that we're coming in here with. You still doing okay?
Oh, yeah.
Okay. All right. So our first presenter is going to be Lisbeth. If you could take it away.
Sure,
Yeah.
I am so
Let me
happy
bring-
to, and I'm thrilled to be invited to do this, and really excited that you're all here and that you care about something that I also care about so passionately. And I really look forward to sharing my thoughts with you, and most importantly, having time to hear from you after we're all done. This is a really exciting day, and I'm looking forward to trying to turn you all into affordable housing advocates. So I want to start by talking. So my job here is to talk a little bit about what affordable housing is and how we make it work, because it's pretty complicated and really important. So I want to kind of take the pieces apart and help explain how it works. But in doing that, I also want to talk to you a little bit about my passions for this, and in particular, why I think affordable housing in Newton is so important and how we can make it work in Newton. So the first thing I want to do is change your thinking a little bit. When we say affordable housing, that thought or that word is often associated with government subsidies. And those subsidies are extremely important as a tool for housing affordability. And I'm going to talk a lot about that in a couple of minutes. But I prefer to use the phrase housing that is affordable. And I do that because I believe it speaks much more broadly to the price of housing, which is hugely important in Newton in particular, where the price of housing excludes most people from enjoying all the wonderful things that Newton has to offer. And I also personally believe that access to decent housing that is affordable should be a basic human right. Just like we've made progress over the last decade in making access to affordable healthcare a right. And for a long time, through the food stamps program, we've also made access to basic nutrition a right. I think access to housing that's affordable should also be a right. So if you could advance to the next slide. The United Nations actually agrees with me here and says that access to adequate housing is a fundamental human right, including the right to live somewhere in security with peace and dignity. The Human Rights Declaration that kind of underscores this specifically includes the security of tenure, which means not getting evicted, adequate conditions to live in, and protections against people being forced out to their access to quality, affordable housing. And access to housing that's affordable is really the underpinning of community vitality. It's actually included as something that we call a key social determinant of health. And a social determinant of health is a measure that talks about providing health to individuals, providing health to communities, and really talking about regional prosperity, which means supporting, in particular in this case, our middle and low wage workers who keep our economy going in ways that they can afford their housing. And I think you're going to hear a lot about this kind of theme from me, and I know from the other panelists today. So if you could move to the next slide. So if housing is a human right, why is Newton the right place for housing that's affordable, and how do we make that happen? So professionally, I've dedicated my career to fighting for housing that's affordable. On the personal side, I advocate for housing that's affordable in Newton because my twins graduated from Newton North in 2018, and someday, if they want to live in Newton, I'd like them to have that choice. And access to housing that is affordable is particularly important to young people who are just starting out. And I also worry about our planet, and the planet that you and my kids will inherit from me and my generation. And as you can see on this carbon footprint map of Boston, urban areas are the best place to live with a low carbon footprint because they are walkable, they have public transportation, and they use land very efficiently. On the map you can see here, the green represents the lowest carbon footprint, which is the urban and suburban core of Boston. And red is the highest with that kind of yellow exurb zone in the middle. So while cities produce high amounts of carbon and we think of cities as dirty and they must be huge polluters, the reality is that the amount of carbon produced per person is lowest in cities and their surrounding transit-oriented suburbs because density is a very efficient way to use land. Yet from 2009 to 2020, in Greater Boston, we only created 1 new house for every 10 jobs that were added. And this created a lot of market pressure in our region, which caused housing prices to increase at like radical rates. So in the last 10 years, housing prices have increased 53%. And this has far outpaced any growth in people's income. And this is exactly why over half of the Greater Boston renters are considered to be housing cost burden. This means that after they pay for their housing, they don't have enough money left over to pay for other basic necessities like food or healthcare. And that's why more than 25% of Boston area renters are what we call severely housing cost burden. Newton is situated directly on our regional transit spine. We're on 128, we have the Pike, we have the Green Line, the commuter rail, and this is a critical location to expand housing opportunities that are affordable and have a low carbon footprint. So I spend a lot of time attending public hearings in Newton around affordable housing proposals and zoning reform. You've probably heard of Riverside, you've heard of Northland, maybe you've heard of the rezoning effort that's underway in Newton right now. And what I can tell you is when I go to those hearings, many of the people who testify are the older Newton homeowners who would prefer to keep Newton the way it is with low density and big houses. And what I want to tell you today is that we need your voices in the mix, talking about our future and planning for ways that Newton can take advantage of its amazing location as kind of the core of our regional transit system to expand housing affordability options in Newton. It's good for our workers, it's good for people who live here, for people who want to live here, and it's really good for our planet. So if we can move to the next slide, now I want to talk a little bit about what do we mean by housing that's affordable. So there are 2 basic approaches to figuring out what housing that's affordable means, and they involve very simple math. So the government says if you spend 30% of your gross income, that means your income before all the taxes come out, if you spend 30% of that on housing, that should be affordable to you. And the theory is that you'll have enough left over after you pay for your housing for things like food and clothing and transportation. But the reality is that the lower your income is, the less you have left over, even if you spend 30%, for things like other basic needs, childcare, transportation, food, paying for college, taking care of a family member who may have a disability. Maybe you have extraordinary healthcare needs. So depending on the individual circumstances, your other costs can vary dramatically. And the 30% calculation doesn't take these things into account. It also doesn't take into account the fact that we all need to save for retirement. So this is why over half of American families have less than $5,000 in the bank, which can be wiped out in one fell swoop by one crisis, like an illness, a job loss, maybe even a major car repair. So this is why I prefer something that we call the living wage approach, which says that housing that's affordable is affordable if after you pay for your housing, you have enough left over for those other basic necessities. This is a much more nuanced and logical approach, but sadly, it's not the measure our government uses. So let's dig a little deeper into this 30% calculation. So if you could go to the next slide. So the 30% calculation, I wanted you to sort of see the different income trends that exist in our country and our city and the region, and to understand how that translates into how much people can afford for their housing. So the top 10% of earners in the United States earn a little over $158,000 a year. Newton's median household income happens to be just about the same. And 30% of $150,000 to $160,000 a year is $44,000 a year. And if you divide that by 12, it means that the top 10% of earners or people in Newton can afford about $3,700 a month for their housing. And that's a lot of money, and that can pay for a lot of housing. Well, let's talk about people who aren't the top 10%. So the Massachusetts median household income is $81,000, about half of Newton's rate. And those folks can only pay about $2,000 a month for their housing. And for those who earn even less than the median income, and in this case, we're going to use 60% of the median income, their income is $64,000 a year. And this means they can only afford about $1,500 a month for housing. And I use this 60% measure because that's a common government measure that's used to determine people's eligibility for housing subsidies. And I'm going to talk about those more in a minute. But before we do that, let's go to the next slide. And I want to talk about what you can actually afford if you make that kind of housing. So just quickly, I want to point out, Newton is actually has a very high cost of living. There's only 5 states or 5 cities in the whole country that have a cost of living that's higher than Newton's. And if you can see on this chart, it's driven by our high cost of housing. So moving to the next slide. So given the high cost of housing in Newton, unless you earn Newton's median income of $151,000 a year, you can't live here. So I bet many of your teachers at Newton North and Newton South can't afford to live here on the incomes that they're bringing in. Even many households with 2 people who are working can't afford to live here because our prices are so high. So what do we want to do if we want Newton to be welcoming, accessible, and affordable to all? Well, there's lots of options. And, you know, in particular, I think given Newton's kind of strategic location, it's really important that we figure out how to do this. So let's go to the next slide. And I want to talk about the 2 basic ways that we create housing that is affordable. So you can impact the housing market to lower costs. That's one way. Or you can use government programs like subsidies that pay the difference between what housing costs and what people can pay. So given the number of people in Massachusetts who can't afford their housing, I really believe we need both strategies, a market-based strategy and a government subsidy strategy. But first, let's take on the market strategy. And this goes right at the concept of supply and demand, which maybe you've heard something about. And if you remember, I said earlier, our region has only built 1 house for every 10 jobs we've created over the last 10 or so years. So supply has not kept up with demand. And the more scarce something is, the more you can charge for it. And this is why housing costs in the region, and in particular in Newton, are so high. To address this, our mayor, Mayor Fuller, actually joined something called the Metro Mayors Coalition, and together with 18 other cities and towns has pledged to build over 180,000 homes by 2030. And if we succeed in doing this as a region, we're just barely going to keep up with the current rate of job growth, but we're not going to get ahead of it. And because Newton doesn't have that much available land to build on, we need to get more creative about how we use the land and the buildings that we have. And we can do that by changing our zoning laws. And that's something that we're considering doing in Newton right now. It's not the focus of this particular session. And I know that there was some conversation about this in earlier sessions, but I encourage you to get in the game and learn about the zoning reform, because what it can do is actually lead to a more creative use of our land, where we're building more smaller houses on the land that we have, which will relieve some of the pressure on supply and demand. And by creating smaller houses, you're actually creating more affordable houses because you're literally paying for less space. So getting a little bit more creative about the kinds of spaces we build and how we use our land is really important. And a market solution with zoning reform can really support that happening. So let's move on to some other strategies on the next slide. So in Newton, there are 2 laws that require that a percentage of what is built be affordable. There's a statewide law called 40B that requires that at least 10% of the housing in every city and town in the state be affordable. And if a community falls short of that, a developer can use the 40B law to get special zoning relief, which lets them build a bigger building, as long as in exchange for that bigger building, they can make at least 20 to 25% of those apartments affordable. So Newton also has something called inclusionary zoning that says if a developer is going to build something in Newton, they have to provide at least 17.5% of those apartments as affordable. In both of these cases, the developers don't use any public subsidy to make that housing affordable. They actually get extra rent from being allowed to build a bigger building, and they can use that extra rent to cross-subsidize those affordable apartments in the building that they're building. And these both are really important laws, and they get used effectively in Newton, but there's two shortcomings to these laws that are really important to understand. The first one is at the very slow rate of development in Newton, we will never get enough affordable housing to make these laws solve all of our problems. We're just not going to be able to do it fast enough or in enough volume. The second problem is because the projects themselves have to cover the cost of the affordable units without any public subsidy, there's just simply a limit to how low the rent can get. And the rents that happen in a 40B or an inclusionary project are really helpful for low wage kind of professional workers, but they're not nearly low enough to help those bus drivers, the service workers, the minimum wage workers who also need housing that's affordable. So what do we do to get housing even more affordable? And if you can move to the next slide, and then I'm about to wrap up here. This is why government housing subsidies are so important. So there's two kinds of subsidies we use to make housing affordable. One's called a capital subsidy, and that's used to offset the costs to build the housing. And the other is called an operating subsidy, and that's used to help people pay their rent. So the way this works is, and this is what I do, this is the kind of development work that my organization does. So the way it works is that typically, without a subsidy, a developer borrows money from a bank, and they use that money to build their building. And then they pay that bank back over 30 years in a monthly mortgage payment. The typical cost to build about 100 apartments in a building is $55 million, or about $550,000 per apartment. And in order to charge enough rent to pay that kind of mortgage, a developer has to charge between $2,500 or $3,000 a month to pay in rent to pay a mortgage to build a building. But on top of that, they also have to pay for maintenance and taxes and insurance and staffing and all that, which brings the total cost of the rent to about $3,500 or $4,000 a month. That explains why the rents in Newton, especially on our new projects, are so high. But we know that these rents aren't affordable to the people that don't earn, that aren't in that top 10% bracket. So we use a capital subsidy, which is a grant from the government that comes in either in the form of, like I said, a grant. It can sometimes be a low-cost loan. Sometimes it's an equity investment that's supported by the government. And what that subsidy, that capital subsidy does is it replaces most of that mortgage. So you borrow a little bit from the bank, but not the full cost of the building, and the government helps pay to build part of the building. And in exchange for that, the developer commits to making the housing affordable. And what that does is it lets you get the rent from $4,000 all the way down to about $1,500 a month, which is a really helpful rent for a lot of people. But again, this is still not low enough for many of our lowest wage workers. So the government also provides something called an operating subsidy, which we can layer on top of that capital subsidy. And what that does is it pays the difference between that $1,500 rent and what a low wage worker can actually afford. And these subsidies are called Section 8. It's the Mass Rental Voucher Program. You may have heard of some of those things. And they're really helpful in helping our lowest wage workers afford their housing. So developers who use capital and operating subsidies, like I described, are typically not-for-profit, mission-driven organizations like the one I work for. It's really complicated and hard to use these subsidy programs. So you have to really care a lot to go the extra mile to make it work. We do this in exchange for agreeing to keep the rents affordable in perpetuity often. So that's a forever government investment. And so what motivates an organization to do this really needs to be the commitment to providing housing that's affordable. It's not a motivation to make money on their investment, because that's really not the point. It's really to provide housing that's affordable. And I feel really privileged to be able to work for an organization like this and have that kind of impact. And so I want to just do one more slide and then hand it off to the other panelists. I wanted to just talk a little bit about special needs housing, because you can build housing that's affordable, but sometimes there are special populations that need different kinds of consideration when you're building housing. And those can be veterans, sometimes older adults, people with disabilities, people who were formerly homeless, people who have been incarcerated and are coming back into the community. So when we build housing for communities like this, those kind of capital and operating subsidies that I explained, those are good tools and we use them. But you have to layer on top of those tools some other strategies that are specifically about supporting these populations. And so we take into consideration things like finding locations that are near services. We think about adaptive design as a way to address people's accessibility needs, or providing community spaces that deliver support programs. We seek ways to get additional government funding to pay for the kind of services and supports that help people succeed in their housing. And we use unique and sensitive ways to select residents and operate a building that are very sensitive to the difficult life circumstances that some people face. And so, you know, as I said, and just wrapping up, you know, I feel really lucky to go to work every day and do the work that I do. I work for an organization that develops housing for extremely low income seniors. We have 2 properties in Newton, actually, Golda Meir House and Coleman House, which some of you may know. And we provide a lot of supports for our tenants who live there, and we help keep people out of nursing homes and keep them living in community settings. So it's a real privilege to be able to be a housing developer, and one that can really have a tremendous impact on people's lives. So I hope I've given you a very basic understanding of how we create housing that's affordable, and that I've inspired you to help advocate and create more of it in Newton. So with that, I'll hand it off to my other panelists and look forward to conversation and questions later on in the day.
So thank you, Elizabeth. That was really remarkable. And you know what probably many of the students watching this didn't appreciate was you gave them some really key real world numbers right there. You were able to talk about the connection between what you make and where you can live. And that's the kind of information that can be really hard to put your hands on when you start to think about, in a few years, when you graduate from college, what sort of salary do I want to make for the career that I've chosen, and where can I live as a consequence of that? So it is not a theoretical discussion at all. So thank you. Thank you so much for that. I really appreciate that. I would like to next introduce Albert Simmons, who is a returning Newton North alum, who is from the legal department of the Boston Housing Authority. So welcome back, Albert.
Thank you. It's great to be here. So good afternoon. Once again, my name is Albert Simmons. I am a paralegal for the Leased Housing Division of the Boston Housing Authority. Leased housing, we call it leased housing. Everybody else knows it generally as Section 8. I am just waiting for my slides to come up, but essentially I want to talk to you from the perspective of a Newton North alum, mostly from the perspective of people, because I think that economic, social impacts, and health has a lot to do with affordable housing, and especially when it comes to the people who are in these programs. So I'll wait for the first slide to come up. But essentially, I want you to first think about, what do you think of when you hear the word house or home? I know that for me, when I thought of the word house and home when I was in high school like you guys, I assumed it was a place that I could eat, a place that I could sleep, a place that, you know, my mom would be at, my dad would be at, and things like that. Next slide, please. It's a place where you congregate, correct? Next slide. I think that the big thing that we need to think about is that a home is more than that. A home is stability for a family. It's security for a family. It's a place where you know that you can get your mail, where you know that you can be comfortable and safe. It's a starting point. It's a place where you learn and where you're taught and where you grow. And I want everybody that's in this group right now to just kind of think of what would that be like if you didn't have your home? How would you feel? What do you think would change, and how that would affect you? I think that that is something that I believe gets forgotten a lot in these conversations. Next slide, please. So I want to talk about a brief little history with myself. My family has been in Newton for around 150 years. As you can see, it's longer than Newton has been a city. My whole family lived in a place called the Village, which was right behind St. Bernard's Church. What happened around, I believe, the 60s was they decided to build the Mass Pike. And my family and a lot of members of my family and my cousins and a lot of people that lived in that area called the Village actually were forced to move due to eminent domain. They wanted to build a pike, so they gave us some money and allowed us and took our homes. Now, luckily for me, my grandfather and many of his brothers actually pulled together some money to allow my grandfather to get another house in Newton. Unfortunately, for a lot of Black families that lived in the Village, including, like I said, some of my cousins, they could not get the money to live in Newton again. They could not get the money to live in Massachusetts again, so they actually had to move. Some of them are down south and across the country. Now, I'm telling you guys this story because this is a story of affordable housing and why affordable housing is necessary. Next slide, please. Now, one of the things that I do at the BHA is, like I said, I'm the paralegal. What the BHA is it's one of the largest housing authorities in the country. I believe it's the 5th or the 6th, and it's the largest housing authority in the Northeast. We subsidize and house around 34,000 people in the city of Boston, as well as greater Boston and inwards of 495. So I want you guys to just take a quick thought about this. There are 34,000 people that the Boston Housing Authority helps with their homes every single day. That's 34,000 families, 34,000 children that would not be able to afford housing without subsidies. As you can see from the mission statement, our goal is to provide stable, quality, affordable housing for low and moderate income persons. We try to do this with integrity and mutual accountability. Next slide, please. So I wanted to talk to you guys quickly about like a couple of different types of subsidies that we generally deal with. Like I said, I'm on the Section 8 side, so I know that a little bit better, and I wanted to kind of share that with you because I feel like people have a lot of stigma about the Section 8 program. But starting with the subsidies, we have 3 different types of subsidies here. There's multiple different types of subsidies that deal with tenant-based vouchers, as well as moderate rehabilitation that deal with people that may need some support. I'm going to talk about these 3 today because I think that they're some of the most normal and most interesting ones. So tenant-based vouchers are what people normally think of as Section 8. A tenant-based voucher is connected to the family. So we subsidize the family. The family is allowed to take that voucher as a mobile voucher and move from unit to unit as long as it's within our payment standards and as long as they can afford it. The next subsidy that we have is a project-based voucher, or a PBV as we call it. Now, those are units that we subsidize ourselves. A family can move into that unit and then but the family cannot move from that unit. Typically what happens is, at the Boston Housing Authority, is a family will start in a project-based unit, and then they have the ability, if there are vouchers available, to open up and request a tenant-based voucher, and then they could move anywhere within 495 for the Boston Housing Authority. Lastly, I want to talk a quick bit about HUD-VASH vouchers. Now, what a HUD-VASH voucher is it's a collaboration between the Department of Housing and Urban Development as well as the VA. Now, what the HUD-VASH vouchers are and why they're so unique is because they are made specifically to help homeless veterans. Now, I think that this is a great project that they have collaborated on, and I kind of want to give you an example of one of these people. So there was a participant that was part of the Boston Housing Authority who had been chronically homeless, and he had actually lived in the Logan Airport for 20 years. What happened was HUD, as well as the Boston Housing Authority, as well as the VA, collaborated to get him a voucher that also provided him support and services that allowed him to live in a unit for the rest of his life. So I think it's very, very important that we not forget that these are people, and people can be homeless. People can be homeless for a very long time. And these are the types of subsidies that help these people get out of that rut that they're in. Next slide, please. So moving on to the rental market, I believe, as Elizabeth said very well, the rental market is exploding exponentially at this point. As you can tell, rents have gone through the roof. And I kind of want to talk to you quickly about what the BHA is doing to help subsidized families deal with the growing rental market. So fair market rents are what HUD uses to determine what is fair and what rent should be paid in a specific metropolitan area. Now, fair market rents are used to determine the payment standards that the housing authorities can use to subsidize people. Now, because Boston's market has grown exponentially, one of the things that the BHA has done is we've had to reevaluate how we look at rent. So in order to do that, we went to HUD and actually discussed with them and came up with a way to do that. And that's called the small area FMR, small area fair market rent, or the exception payment standards. Now, what that means is instead of looking at the entirety of Massachusetts and the entirety of the metropolitan areas, the BHA now looks at area codes and determines the fair rent based on the area codes. That allows us to give more subsidy to people looking to move into areas that may have higher rents. An example of that is in 2019, we started this small area FMR standard. Before that, there were 3 families that were leased up in Newton. Since the SAFMRs have actually come out, I believe that there are around 20 families that have moved to Newton as a result of this SAFMR. Next slide, please. So why do we want affordable housing in Newton? Now, I think that this is a question that a lot of people ask themselves and may not have an answer for. I know that Newton is it tries to be a very diverse place, and we are. I think that a big thing about diversity is that diversity is always looked at racially, but economic diversity is also just as key a factor. I know that for me in high school, there were times where people told me things that I wouldn't have necessarily thought of because it came from a different viewpoint. It came from a different person with a different lifestyle than me. And I think that that is key to making Newton an inclusive and wonderful place. I also want to come back to the point that these are people, and people need to be housed, and people need the opportunities to gain the education that Newton provides. Newton Housing Authority has 1,300 residents. Now, if you think about that, that's 1,300 people that could be your grandmother, your uncle, your friends. It could be the person next to you. And I always like to maintain that, because what affordable housing is about is making sure that people, and not that people, get the opportunity to live their lives sustainably and healthily in their environment. And I think that Newton would agree with me when I say that affordable housing is necessary in Newton to help with that. I thank you guys for your time, and if you have any questions, I will be excited to hear from them, hear about them after this.
Albert, thank you so much for your remarks. Two things in particular really resonated with me. One is that you bring a rich, deep perspective, having grown up here, to this issue and lived this issue. And second, that for students sitting in the audience going, what is to become of me? What am I going to do for a living? Here you are, right? There's life beyond Newton North, right? So you take what
there is definitely life beyond Newton North.
In fact, it gets
but
better.
It's always nice to come back.
Well, thank you for being living, breathing proof of that so much. Our last speaker this afternoon is Allison Beauville-Amon, who is the Director of Policy Strategy with Children's Watch. And so, Allison, welcome.
Thank you, and it's wonderful to be with you all this afternoon. So I am going to be talking today about health, and so I'm looking forward to engaging with you. So I want to start with actually a question to everyone. So I know it's late in the afternoon, but I'm going to ask you to put some responses quickly into the chat. So my first question to you, I'm going to start with this question around, and I hope that we'll answer in the affirmative, whether where you live matters for your health. So we're going to start with a health indicator of life expectancy. So how long someone can expect to live. So I want you to put in the chat how long you think the life expectancy of someone that lives in Newton is. And just to lead us off, I'm going to give you the life expectancy for the United States. Okay, so for the entire United States, the average life expectancy is 78.5 years. So what do you think the life expectancy of someone who lives in Newton is? And I'll give a couple seconds for people to put, okay, 85, 84, 80, 86, 85, 87, 80, 80, 90, 92. Okay, great. 100. People are really ambitious about Newton. Okay, let's see what it is. Here we go. Go to the next slide. The life expectancy in Newton is 94.2 years. Okay. Next question. You recognize this map, right? This is the city of Boston. This is the T map. Okay, so now we're going to go to Nubian Square. We're going to go to Roxbury. What do you think the life expectancy is for someone who lives in Roxbury in Boston? 75, 74, 80, 80, 76, 66, 70. Good. Okay. Here we go. The life expectancy in Roxbury is 73.2. So I just want you to think about this. The distance between Newton and Roxbury is about 7 miles, and a life expectancy difference of 21 years. So I'm going to tell you a little bit about our work and our research and why housing is really critical for health outcomes. That example was just one example. We could do many examples of health disparities across neighborhoods, and we'll talk a little bit more about that in a minute too. So I work for an organization called Children's Health Watch. We're a network of pediatricians and public health researchers, and our work is really focused on improving the health of children and families and really advancing health equity by informing policies that alleviate economic hardships. And so we do this through research. So we start by talking to parents of children, bringing their child in for medical care in emergency departments and primary care clinics across the country. And we take all of this research, all of this information on families' experiences in affording basic needs, the health of their children, what programs they might be participating in, and we convert that into policy recommendations. And so today, I just want to sort of ground us a little bit into why we look at things outside of the health system to understand indicators of health. So we usually think about health in the context of going to the doctor's office, or maybe you think of health behaviors like whether you smoke or if you eat well or exercise regularly. And those things certainly contribute to health, but research shows that that probably contributes to about half of what makes us healthy. The other things that make us healthy are the things like our physical environment and other socioeconomic factors that really round out whether someone is able to become and remain healthy. So at Children's Health Watch, we focus on a cross-cutting set of issues, including food, housing, energy, healthcare hardships, so whether you can afford medical care and prescription medicines, and childcare, all of which are really critical for families with young kids to afford basic needs and to be healthy. So of course, today on Housing Day, I'm going to be focusing particularly on housing and what we have learned over and over again in our research and other researchers from other researchers is that a stable home in a neighborhood that's connected to opportunity is really a prescription for good health from when you are in the prenatal period all the way through old age. So I'll be briefly just talking a little bit about these sort of 4 domains. So there's a lot of research and work out there on how these 4 domains, so stability, quality and safety, affordability, and neighborhood, impact health and health outcomes. So let's start with quality, because I think often when people think about housing and health, they think about the quality of your home. So I want you to think about for a minute what things inside of your home maybe drive poor health outcomes. So why don't people maybe just put in the chat, what are some things that might exist in a home that would contribute to a health outcome? Air quality, cigarettes, secondhand smoke, water quality, good, yeah. Gas leak, oh, yes. All right, excellent. So yes, these are really terrific answers. There's a lot of things in a home that can impact your health, particularly respiratory conditions like mold and allergens and dust, things like lead. We saw the water quality. We know that that was a big deal in Flint, Michigan, lead paint, a number of things that are in our homes that can contribute to whether we are able to thrive in our home or not. And remember that these things aren't evenly distributed, right? So this kind of all goes back to the structures that enable people to either thrive or to be in poor health. And we know that people who live in places where there is low quality housing stock, maybe the housing stock is aging and there's not the capital expenses that Lisbeth really talked about to update that housing, that those things disproportionately affect people with low incomes, affect people who are Black and Latinx and immigrant families in particular. So then next, I'm going to talk about these 2 categories together, stability and affordability, because they're often so interrelated. And my colleagues that presented before me really did a wonderful job of describing to you what affordability really means in housing and how people are able to either afford their housing or not afford their housing. And so I want us to think for a second about this affordability and stability issue as sort of an iceberg. So at the top of the iceberg, we have homelessness. And this is really when people think about people that are experiencing a very extreme form of instability, they are not able to afford a house, that they might become homeless. And I think this is kind of the image that we have in our minds sometimes around like what housing sort of means towards health. And I think it's a really important factor. And I do also want to point out that about 2.5 million children in this country are homeless. We often think about people experiencing homelessness as single adults who you might see, in a park or unsheltered outside. But really, we have a massive family homelessness crisis, and not only in this country, but in the state of Massachusetts as well. They often just exist behind closed doors. But sort of lurking below the surface is really this crisis around housing instability. It's really the sort of forms of housing instability that you often don't see and recognize, and may even be happening among your classmates or your friends, that often go unnoticed. These conditions are things like parents struggling to afford the rent and maybe falling behind on rent payments, or when that occurs multiple times, being forced to move through an eviction, or moving frequently because they're not able to afford their homes. And all of these conditions are really detrimental to health throughout the lifespan. But really sort of what's undergirding a lot of this are our policies, structural racism, unaffordable housing, living wage policies, all of those things that are sort of making this iceberg exist to begin with. So there's a lot of research around how those conditions independently and collectively impact child health, again, from the prenatal period, so babies that are born low birth weight or born early, mental and behavioral health conditions for both children and adults, including anxiety and depression, thinking about how stressful it is to not be able to afford your rent. As Albert said, a home is a foundation for everything. Developmental delays. I've consulted on cases where families, children didn't learn to crawl at the right time, or walk, or do all these really critical things because their housing was unstable and inadequate for them. Of course, that leads to increased need for urgent health services, overall poor health, adverse educational outcomes in the long run. And then also, you'll learn this soon enough when you are living on your own and you're paying your own bills, but rent eats first. People pay their rent first, because if you don't pay your rent, you are going to be kicked out. And so what that means is that when people pay their rent, but they don't have enough money for other things, they start to cut back on expenses like food, that's a little bit more flexible, or other expenses that are necessary, but can be fungible in a family budget, which also all impact health. So then finally, we're going to get to neighborhood. And I know that as part of zoning day, I'm sure you talked a lot about neighborhood, and I saw on the flyer there was a map, so I'm sure you looked at a lot of maps. So I'm not going to spend a lot of time on the next couple of slides, because I just want you to recognize a pattern in these next few slides, okay? So these next slides are going to be maps of Boston that are color-coded by neighborhoods in Boston, and the deeper colors are the adverse health outcomes for that indicator, okay? And so I just want you to, as you're looking at this, I just want you to see the pattern, okay? So this first example, oh no, this first example is asthma by neighborhood in Boston. So just the deeper orange here means that there's more asthma, and the lighter orange means there's less asthma, okay? So just notice the pattern here. Okay, this next one is diabetes. Again, deeper color means there's more diabetes in that neighborhood than the less deep colors. And then here is heart disease hospitalizations. Again, deeper color means there's more hospitalizations, okay? So you probably noticed, right, that there were some neighborhoods on every single one of these maps that was coded the deeper color, right? These are 3 different conditions. These are non-communicable diseases and CDs, so they don't pass from one person to another. And they exist because the economic conditions, the housing conditions, the investments in those communities are the same. And those drivers of poor health outcomes often exist in those communities together. And then you can look at infectious disease. Oh, this is very, I'm sorry about how blurry this picture is, but this is COVID-19 rates. And again, you can see the Roxbury, Dorchester sort of corridor there, and the deeper color around infection rates. And we also saw this with mortality and hospitalization rates in COVID-19 as well. So again, these conditions are not accidental. The neighborhood that you live in and the factors that contribute to that are underlying conditions that really impact health. And so I want you to notice, so you saw the deeper colors, right, were the poor health conditions in those previous 4 slides. Now I'm going to show you a different map. This map is created by a group that creates this child opportunity index that takes a lot of different factors, things like green space, built environment, access to jobs and transportation, education, poverty, wealth, those sorts of things. And they create this index where they can really shade neighborhoods to see where does opportunity, connection to opportunity exist for children. And so what you see here is basically the opposite of what we saw in those previous slides, right? So the areas with the low opportunity levels here were the same neighborhoods that we saw the high rates of disease burden in those other slides. So what I want you to take away here is that the sort of rate of asthma or the rate of diabetes or rate of heart disease or the rate of COVID-19 infection are all predictable based on the economic factors, the housing factors, the underlying drivers of health that exist in all of these communities. And so, you know, really the way that we solve these problems is getting at the roots, getting at the structures that create these inequities, getting at the policy change that's necessary. And so, the final word that I will leave you on is there were a lot of pieces around what's happening in Newton. And as someone that works a lot on federal policy, I can tell you there's also a lot of opportunity happening on the federal level. The President of the United States, President Biden, just released a massive infrastructure plan where he committed to $200 billion in funding to support housing for neighborhoods and people and families who live in dilapidated housing, who struggle to afford housing, to really improve their housing. And so, and your member of Congress, Congressman Auchincloss, is actually on the committee that will write the part of the legislation related to housing. And so weighing in with your member of Congress, telling him why it's so important to invest in housing, how it impacts health across the lifespan, education outcomes, how it impacts your own life and the people that you love, I think is really, really critical as you go from this day. So with that, I will end my presentation, and feel free to email me following this, but I'm also looking forward to this discussion as well.
Thank you so much, Allison. That, once again, was amazing. I guess the thing that really jumped out for me about what you had to share was one of the hardest things to do in life is to know where you are when you're there. That we walk through our lives every day, we live in our homes every day, and sometimes we just don't think about it that much. And what kind of the genius of your presentation was your ability to take data from multiple disciplines, from economic disciplines, from the healthcare disciplines, and put them together in a graphic interface that told really cool, powerful stories. So thank you so much for that. That was terrific. I'm going to hand it now over to Olivia, my co-moderator here, who's going to introduce some questions to the panel. So Olivia, you're on, kiddo.
All right. Okay. The first question that we have today is from the Q&A feature. And it says, is a lot of the health conditions in diabetes also because of the lack of access to healthy food? Someone in a low-income neighborhood cannot afford a $12 salad. So as a result, there is primarily fast food restaurants. So whoever would like to take that question, go for it.
Sure, that's an excellent question, Duncan. And I would say, yes, absolutely. Another map I could have shown you, but I didn't, is really where grocery stores are. We know in communities that are predominantly low income, there are fewer fully stocked grocery stores. There are more likely to be things like bodegas or corner stores that don't have, the full range of fruits and vegetables. We also know that often, as I mentioned, often it's really difficult for families with low incomes who are paying high housing costs. As Elizabeth mentioned, those housing costs burden families that are dedicating so much of their money to housing to really be able to afford healthy things like salad, which, as you noted, is more expensive in our grocery stores and other places than processed foods and high sodium foods. I'll go ahead and answer this one too. This is an excellent question from this anonymous person asking about systemic racism playing into higher rates of health problems. The answer is yes. There is no biologic difference between people across races. So all of the health disparities that you see at their roots are related to various forms of structural racism. So remember that race in itself is a social construct. Biologically, genetically, we sort of all are the same, and so so all of the different rates of health problems are really related to a number of interlocking conditions that exist outside of an individual person's genetic code, for example.
And Elizabeth and Albert, you guys are welcome to add on to any answers or questions that you would like to. I don't know, and then Mr. Gescheld, I think you had some questions as well while we're waiting for any more Q&A questions to come on in. So please feel free to leave any questions into the chat that you'd be curious to hear an answer about. Oh, Mr. Gescheld, I think you're muted.
That's right. What kind of a meeting would it be if someone didn't need to unmute themselves? Okay. So one of the questions that came into us before we started the meeting is what solutions are being tried to help ease the affordable housing shortage? And, you know, if you could answer in language that even I could understand, that would be great, because I know you guys have deep expertise in this, but I think most people, myself included, are really kind of just coming to this issue for the first time. So any one of the three of you that would like to jump on that, that'd be great.
So I guess I can kind of start off. I mean, I know that I briefly talked about how SAFMR and the exception payment standards are trying to kind of bridge the gap between what's going on with the rental market as well as what's going on specifically in Newton as well. I can also tell you that the Housing Authority is actually starting to convert a lot of their public housing properties. One of the things that government does well is we pay for things. We are not so good at putting in structures to make sure those things get upkept and held at a higher standard. But we've been partnering with a lot of different private real estate investors to redo our public housing program. So all of the public housing we're actually trying to convert at this point into a lot of mixed housing, while still maintaining the 1-to-1 ratio of public housing participants. So a lot of the public housing is actually going into redevelopment, and then all of those public housing participants will either receive a voucher to move, or will actually have first opportunity to get back into one of the renovated properties. So that's just some of the things that the Housing Authority is doing. I also know that there are a couple of different programs that we're using right now, specifically a program called the ECHO program, where we're trying to take participants who may live in these more high-risk areas and move them to places like Newton, or they're called ECCs, which are extra opportunity, expanded choice communities. And Newton is one of those communities where they have more opportunity to grow and be healthy. So those are some of the things that the Housing Authority is doing.
Thank you, Albert.
Yeah, jump in too, and just kind of try to reemphasize some of the points that I made in my presentation about the importance of government subsidies. And Albert talked about them a lot. Allison referred to them as well. And there just simply are not enough of them. And so, you know, I love the mention of the huge infrastructure bill. That's a really big and dramatic move. And actually, President Biden also, during his campaign anyway, talked about the concept of housing being an entitlement and really looking at the kind of Section 8s that Albert talked about, those operating subsidies that I talked about, being broadly available to anybody who needs them. So I would say, you know, a key thing that you all can do is get in the game and help advocate for these things, help advocate for expansion and growth in the kind of public subsidy programs that really help bridge the gap between the tremendous cost. I mean, it costs a lot to build and operate housing. And it's, you know, it's hard to change that, but we can really get at public policy, which brings more resources to the table to bridge the gap between that high cost and what people can pay. And then the other thing is to really get involved in the conversation that's happening in Newton right now around zoning reform and really changing our land use policy, because it takes being much more creative and strategic about seeing the value of land. I mean, it's a key cost of building housing is paying for that land. So we need to use it really smartly, especially kind of in a dense urban area like Greater Boston. So, you know, I think what you all can do is get in the game and help advocate, you know, write your congressman, write your senator, make calls, come to hearings, and lift your voices about how important these things are.
Thank you. So I think it's fairly clear that all of our panelists are kind of on the progressive side of this discussion and advocates of reform in affordable housing and zoning. But there's a really good question that's sort of come up in the chat that I'd like to ask the three of you to address as you see fit. And that is, you know, every argument has at least two sides to it. And so, you know, when you engage in debates with folks who are on the other side of this, who are opposed to zoning reform, opposed to subsidized or government involvement in affordable housing, what do those arguments look like?
Sure, I can start. I think I really want to start with the outcome that we're trying to get towards, right? That I hope that we can come to an understanding that we want a future for the children of our country that involves them being healthy and able to participate fully in the workforce, and that we want everyone to be taken care of. If we can't start there, I'm not sure where we can start, but I think that we can have a healthy debate around where what are the best solutions for that. And I think that history will show, and that sort of policy analyses will show, that the market hasn't taken care of many, many people. And so if we want to really make some traction on these issues, we're actually going to have to look towards deep investments in places that are not going to be able to lift themselves out of poverty or out of certain circumstances. We have to sort of take an expansive view of what policies got us to the place where we are, and what policies and structures are going to be necessary to get us out of that. And I think there's a lot of robust, you know, I have a set of policy platform, right, of things that I advocate for, and I recognize there's a lot of robust conversation around how to move forward with that. But I think I often try to start with, can we agree on the same goal, and then go from there.
So I'm happy to jump in here. I think that's fabulous, and I agree with that. And I would add to that, you know, a lot of times when you get in debates with people, the reasons you hear that people don't want these things to happen, for instance, zoning reform in Newton, you know, as I mentioned, and I talk a lot about this with people, they don't want to see change happen. They you know, they like the low density, they like Newton the way it is. So I try to talk to people about how, what are the things, kind of like Allison's talking about, that we share, that we share a concern in. And while change can be hard, change is really important for the things that I think we all share concerns in, which is ultimately the health of communities, the health of individuals, and the health of the planet. And so trying to move past appealing to an individual, caring about another individual, because sometimes people don't. So trying to establish kind of what interests people have that we do have in common, and explaining why these kinds of changes are in the broader interests of the community at large. And one of the reasons that I think people also oppose affordable housing is they have the perception that it's going to hurt their own property values. A lot of times people in a community, they own houses, they live here, they have a value that they want to protect, and they perceive that change in a community, or more different kinds of people moving into a community, are going to lower their property values. And it's just simply not true. So having those statistics to back you up when you're talking with people is really important, because there have been a lot of studies out there that prove over and over and over again that diverse, healthy, welcoming, interesting, vibrant communities have strong value in so many ways, including those property values. So, a lot of times people go right to their purse and think that they're protecting their own personal interests. So trying to, give them different facts and elevate the conversation to a broader community concern, I find can be a helpful strategy.
All right, we are almost out of time, but we're going to take one more question just before we do. So we had a question that asked, in addition to making Newton healthier, living more accessible by doing things like lowering our local preference, how can we improve more high-risk areas to make them healthier and safer, or is this counterproductive? And then after that, we will move to our closing. So take it away.
Sure, I'd love to jump in on that. I think that is a really terrific question, and I do not think it's counterproductive to invest in those communities at all. I think there are a few different ways that we can address the shading that I showed on that graph. One is our solutions that Albert brought up, where we really give people the ability to move if they want to move with a subsidy or other means. The other thing that we can do is make sure that we invest resources in those communities and make sure that the policies that are passing through Congress and our state legislators and legislature and our local authorities really recognize the disinvestment that happened over many, many decades, centuries in this country, in those communities, and that we begin to make investments to start to make up for some of those drivers that drive health disparities. So that was a really excellent question. Appreciated it.
All righty, as we finish up, I'd just like to thank our panelists so much, and our teacher moderators for taking the time out of our days for coming and talking with us. We really appreciate it. And we'd also like to thank Nevena Pilipovic-Wengler and Kat Kemet from the Newton City Planning Department for their help in creating resources for this event and helping put this event together. If you want to have your voice heard in the zoning redesign project, reach out to Nevena at the email that's going to be put into the chat. This is one of the ways. We had a bunch of questions in the chat that were asking what individuals, especially young people, can do to work on zoning redesign and zoning laws. And so this is one of the ways that you can get involved. You are also able to sign up for the zoning redesign newsletter, which Coral will also have put in the chat so you are able to sign up for that also by emailing Nevena, and that is an awesome way that you are able to get involved with zoning redesign in Newton. And we want to have a final thank you to Terry Yaffe, Claudia Wu, and Monica Bushnell from the CCES for spending hours upon hours helping us put this event together. And if you'd like to get more involved with Newton's zoning reform process, or even just learn more about it, please contact us at nnhsnextgenvoices@gmail.com, which Coral also put in the chat. There's a lot of emails, so sorry to bombard you with them. Or the CCES, and you can get in contact with our advisors, because we are doing a lot of work on zoning reform and education surrounding zoning. So if you're at all interested, please reach out to us. So yeah, thank you all so much for attending. The CCS, I think, would like to do a really quick pitch before we end our day, but thank you all for being here. So really appreciate it. Yeah.
Great. We just thank you all for coming. And just a reminder that we have an open door, open Zoom policy right now. Anybody is, please do contact us, any student, faculty member, anyone who's interested, and we will connect you with clubs or other students who are working on issues that you care about. We thank you so much for coming. We thank the panelists and the students and Mr. Gesselt as well. So thank you so much.
And go home and talk about this with your family and your friends.
Sure. And also talk to your elected officials and those in your community. And if you ever need help thinking of what to say, who to say it to, feel free to email us or come to Next Gen Voices on Tuesdays during Flex Block, and we'd be happy to help guide you through that.
Okay.
All right. Yeah. Thank you all. Have a great rest of your afternoons.
Yes.
Thank you so much.
Thank you, everyone.
Bye-bye.
Attending.
Thank you.
Okay, you're going to stop recording, Claudia. I can do it.
Can you do it? Yeah, I
Yeah.
got it. Yep, I have it.